An HIV quality care advocate is distinct from being an HIV agitator and HIV activist in several ways. An HIV quality care advocate focuses on ensuring that individuals living with HIV have access to high-quality medical care, support services, and resources to effectively manage their condition. They work closely with healthcare providers, government agencies, and community organizations to promote best practices in HIV care and treatment. By advocating for policies and programs that prioritize the well-being of people living with HIV, quality care advocates help to improve health outcomes and quality of life for those affected by the virus. In contrast, an HIV agitator may use more confrontational tactics to bring attention to issues affecting people living with HIV. Agitators may engage in protests, demonstrations, or other forms of activism to raise awareness about discrimination, stigma, or lack of access to care. While their methods may be more provocative, agitators play a vital role in challenging systemic injustices and pushing for change within healthcare systems and society at large. Similarly, an HIV activist is someone who actively works to promote the rights and well-being of individuals living with HIV. Activists may engage in a range of activities, including advocacy, education, and community organizing, to address the social, political, and economic factors that contribute to the spread of HIV and impact the lives of those affected by the virus. By advocating for policy changes, funding for research and services, and the elimination of stigma and discrimination, activists play a critical role in advancing the HIV/AIDS movement. While all three roles, quality care advocate, agitator, and activist, are important in the fight against HIV/AIDS, they each serve distinct purposes and employ different strategies to achieve their goals. Quality care advocates focus on ensuring that individuals living with HIV receive the best possible care and support. Agitators use more confrontational tactics to challenge systems of oppression and discrimination, and activists work to create systemic change through advocacy and community organizing. To illustrate the distinction between these roles, consider the example of a person living with HIV who is experiencing barriers to accessing medical care. A quality care advocate may work with healthcare providers to ensure that the individual receives timely and appropriate treatment, while also connecting them with support services such as mental health counseling or housing assistance. The advocate's goal is to improve the overall quality of care for the person living with HIV and address any barriers to treatment that may be present. On the other hand, an HIV agitator may organize a protest outside a healthcare facility to draw attention to the discrimination or lack of services that the individual is facing. By bringing visibility to the issue through direct action, the agitator seeks to create pressure for change and hold those in power accountable for their actions. While the approach may be more confrontational, it can be effective in raising awareness and mobilizing community support around the issue. Meanwhile, an HIV activist may work to change policies or laws that contribute to the barriers faced by the individual living with HIV. This could involve advocating for increased funding for HIV prevention and treatment programs, pushing for laws that protect the rights of people living with HIV, or partnering with other organizations to address systemic disparities in access to care. By working on a broader level to address root causes of HIV-related challenges, activists can effect lasting change that benefits the entire community. In conclusion, being an HIV quality care advocate, agitator, or activist each plays a unique role in the fight against HIV/AIDS. While quality care advocates focus on improving the health and well-being of individuals living with HIV, agitators bring attention to systemic injustices and push for change through direct action, and activists work to create systemic change through policy advocacy and community organizing. Together, these roles complement each other and contribute to a comprehensive approach to addressing the complex issues facing people living with HIV. By understanding and appreciating the distinct contributions of each role, we can work together to build a more equitable and inclusive response to HIV/AIDS. 10 down WJ, where creativity meets impact.